when you look at the government being comfortable saying they are offering services to Kenyan and they pay them 15,000, which is taxable, they only remain with 9,000, I think it is a dismay to Kenyan. And this is why Kenyan must continue to push for the change we want. And at least I want to appreciate for the president for asking some of these ministers who have not been assisting him, like Nakumicha, to go home, because we believe the problem we have about internship, she is the person who occasioned this. More specifically, the delay of posting of interns, she's the person who needs to take that blame. She came and proposed a reduction in terms of payment of the BSc interns and also the other medical staff who go for internship. But to make matters worse is that we have approved staff establishment for intern personnel in the Ministry of Health that gives them job groups that they are supposed to be paid with. But the ministry is undermanned to implement. For instance, the diploma is supposed to be paid close to around 79,000. But the ministry is not able to actually budget for that. The staff establishment indicate the numbers that we expect to come out that go for training every year. For instance, for the diploma, they are supposed to be around 3,500. For the BSc clinical officer is 1,000. And also the MOs, the MI, even the dentist, all the numbers are there, which means that the staff establishment for the interns, which is approved by the Constitutional Board of the Search of the Public Service Commission, is supposed to inform the budgetary process for the interns. When you have incompetent minister who cannot actually look at that matter in terms of what is supposed to inform the budgetary process for the interns, we have a quagmire that we have now currently, that we don't have money. We continue begging. But again, I must say, the president, when he appeared on the space, he promised that the money for intern is now available. Why is it that the ministry has not posted them up to date? And now we want to say, for those who have been working without pay, they must be paid because that money is so little. If they will not pay in the end of this month, we will actually call them out and this facility will be left. Because I've gone to places, you go to in wards, there is no even qualified staff. It is only medical staff, clinical officers, interns, and the other interns who are there. Meaning, every time we have been telling the government that these people constitute 27% of our work staff, they don't even listen because in any case they don't even seek services in our public facility in the internship process. So the government must not kill the health sector in this country, because we need to see a government that is serious, allocating money that is required to carry the activity of training of healthcare workers. Because it is in the healthcare workers, competent, trained health workers, the clinical officers, that again translate to the services that we give to Kenyan. If that is not ensured, then we must get to know that the government is so wrong, and either they are telling us that we do not need them in place. But again, if they must be serious, we must see the kind of investment they want to put in health. It is the healthcare workers who are the voice of the health sector. They are the people who actually are the hope of the patient.
And we have been here for the past 120 days with no pay. And we are posted here to offer services for the nation. Actually, you cannot be offering services and yet there's nothing in your pocket. You'll be suffering, and yet imagine I'm having blood stains with even no soap in my house just to pay for the basic commodities. So I'm urging the government actually to release our funds. I'm not speaking on, I'm speaking on behalf of this cohort and those who are coming behind us. Let the government actually work.
I'm a CO intern, the outgoing cohort. So I really wish to say this on behalf of my colleagues. We have been here working, really working, not just working the usual working days. Like we work daily from Monday to Monday, no offs. And from Monday to Monday, the time is from 8 up to 8 in the evening, sometimes even further. We do night shifts, and the pay is very meager, by the way. We are here, we signed for 15,000, But in real sense, we are given 9,000. That is almost, even after all those taxations, we have only 9,000 in our banks. So it is really painful for us all, and I would wish not such things to continue for the coming cohorts. So please, the government, we want to urge the government to really consider us. We really work for them, so they should really consider the pays.
I would like to thank the Kisii for coming to take this important exercise, and also like to remind us, we'd like to make sure that our stay here is good, so that we get the best of the services that we can get, and also offer the best services for our clients and patients.
I'm happy to meet you. Thank you, the hospital, the Kisii hospital team, and also my team. I want to thank you. So I'm happy. I know I'm seeing my students.
Why in the church? I'm Apollo Dongo. I work in Homabay as the clinical officer in Chandogo County. I'm in
Good morning, everyone. This one is an open forum. We expect you to speak everything. So don't fear. I also teach at Kisii. I'm not also
Council. I head the training department. And as we placed you in this hospital, found it prudent to come and So that is one of the reasons why we came to follow you up. Also to know if there are any challenges you encountered so that we can be able to.
Asante sana. Yeah, there's another gentleman. Don't doubt yourself.
Yeah? Yeah, feel welcome.
Asante sana. I think I appreciate the admin for introducing the team. Those are the people who are here. At least will listen to you. Want to put it. I think we don't have specific agenda. We are the one to raise the agenda so that we don't cover you. Gen Zs are telling us leaders should not come to tell us what they want to do. So you need to listen. After that is when we can say we might be able to guide in terms of the law, the policy, and how the hospital probably will want you to. Do not repeat what your friend has said, because then it doesn't change. Naelewa? Nanielewa? So that we don't take much time. So I will take the first 5 punch, and if you are willing to be speaking, you should raise your hand. Put the assumption or a disciplinary process. Then the administration need to constitute properly before you call her, so that there is a CEO in the business.
There are fees that were high, they decreased. There are fees that they said it is okay, let it stay like that. There are even fees that even went up. So, because a council also is an organization. You have a law, you have a code. See, they have to be printed. Alright? And you see, those are things that the council sat down, alright? And discussed. And called all the other stakeholders to come and discuss. Alright?
Jason, your first cohort, last rotation, then search.
Amanyano Mambia, passport, last rotation, then site.
We are not there, but we have now staffed our bosses around. Also, we have the council, the association, and the union president. But I will allow at least the admin to introduce them.
Welcome our visitors from the council, and welcome my team. My name is I'm the hospital administrator. So, my team, okay, that.
Morning, everyone. Morning. My name is Julia Mecha, nursing service
People united shall never be defeated. Our people,
United shall never be defeated.
our people,
United shall never be defeated.
comrade power!
Power!
Viva clinician, viva!
Viva!
Viva clinician, viva!
Viva!
We shall not relent. Sawa? Yes. Thank you. Asante. So, who are the leaders? I need to get my numbers.
Can I go cancel?
Wakati uliuliza si hakuna mwingine hata alikuwa